Доброго дня всім. Пані Джил, чи ви мене чуєте через перекладача?
Да.
Добре, бачу, що
Yes,
Джил
I can
мене
hear you.
чує. Угу. Добре. Тоді дуже дякуємо всім, хто приєднався. Я бачу, що нас вже 153 людини в Зумі. Не знаю, поки скільки нас в Ютубі, але зараз побачимо статистику. Дуже дякуємо всім, хто приєднався. Ми продовжуємо нашу серію, яка має відношення до катамнестичного спостереження. І наша спікерка сьогоднішньої серії – це пані Джил Zwicker, професорка кафедри ерготерапії та науки про життєдіяльність Університету Британської Колумбії в Канаді. Ми дуже дякуємо Джил за те, що вона погодилась виступати для наших спеціалістів. І ми прямо одразу будемо починати для того, щоб лишити вам час на питання, які, безумовно, будуть. Питання, як завжди, кидайте в загальний чатик, і я потім в кінці буду їх зачитувати і будемо отримувати відповіді. Всім дуже дякуємо. Тоді прошу пані Джил починати.
Thank you so much, everyone, and it's a pleasure to meet with you today. So, as said, I'm Jill Zwicker. I'm an occupational therapist by clinical training, but have been working with children with DCD for a number of years. So, what I'd like to share with you today is, in particular, the relationship between prematurity and developmental coordination disorder. Just a second, now my slides aren't moving. There we go. I'd like to just first acknowledge I am coming to you from Vancouver, Canada, and these are the traditional ancestral and unceded territories of the Coast Salish First Nations, specifically the Musqueam, Squamish, and Tsleil-Waututh Nations. And I'm grateful to be able to live, learn, work, and play on these lands. So what I thought I'd cover today is give you an overview of developmental coordination disorder and the risk factors and early signs. I'll talk about some early motor assessments and DCD, how to identify and diagnose children with this condition, and some options for treatment. So just to start off with, developmental coordination disorder, or DCD, is a very common but under-recognized neurodevelopmental condition. And the cardinal feature, if you like, is difficulty performing and learning motor skills. I'll talk about the diagnostic criteria in a few moments, but it is a difficulty with coordination and learning of gross motor and fine motor skills. It affects 5 to 6% of school-age children. So this is roughly 1 in 20 kids, which is essentially 1 in every classroom, 1 to 2 in every classroom. And unfortunately, at the moment, DCD is often not recognized until school age, if at all. But there's an opportunity for earlier identification, particularly for children who we know are at risk, such as those who are born preterm. It's important to consider this diagnosis because it extends far beyond motor difficulties. The majority of children don't outgrow these difficulties, so the condition does tend to persist across the lifespan. And the difficulties tend to increase over time as the gap widens between what typically developing peers may be able to do with their motor skills. And because of this, there's also secondary psychosocial concerns that develop, and it does have a significant impact on overall quality of life. This is just a visual graphic of the sort of trajectory of developmental coordination disorder without any intervention. And this was prepared by Cheryl Masuna, a colleague of mine also in Canada, but in Ontario. On what would be the y-axis, we have motor, self-care, academic, social, and behavioral and emotional concerns, and age across the top. And we can see at very young ages, from about the age of 2, the children have delays in gross and fine motor skills. They have difficulty riding a bicycle or a tricycle, poor physical fitness, and overall difficulty with motor skills. As they get a little older, this does impact their self-care, being able to use a knife and fork, tie their shoelaces, manage buttons, and so on. And then it does impact, sorry, my screen has got other things coming up on it. This does impact school, particularly related to printing or written output. And they experience a lot of frustration, and because of writing difficulties, they might have lots of great ideas in their head, but not be able to get them down on paper. And so they are not meeting their potential at school. And then socially, they start to limit participation in physical sports and activities, which is where a lot of friendships develop. They tend to watch rather than participate. And they often get teased or bullied about their poor motor skills. And finally, as we get to the early sort of preteens or early teens, then we see symptoms of anxiety and depression, and poor self-esteem, and that greater impact on mental health. But you can see even from a young age, from a young age, they have difficulty, they dislike sports and become frustrated with motor tasks. So you can see this quite early on. So what's most relevant for this audience is that very preterm infants are at much higher risk. In fact, they're 6 to 8 times more likely to develop DCD compared to children who are born at term. And even those that are later preterm, say 34 to 36 weeks, they have a 3 to 4 times greater likelihood of developing DCD. So overall, up to 50% of preterm infants will have DCD. Yes.
I'm sorry to interrupt you, but your presentation is not moving. Is it meant like this? Are we still on this slide or not? Just checking in case.
We're meant to be on very preterm infants, it says at the top.
No, it's just a big table, but I probably am sitting too far from the screen. It's a big table with the columns and blocks.
Okay, I just moved that back. Can you see it now?
Nothing is moving on the screen for the moment.
Okay, it's moving for me, so...
yeah, but it's not moving for us, which is strange because you were sharing the screen, correct?
Yes.
Шановні учасники, почекайте хвильку, ми тут питаємося порозумітись, як так зробити, щоб ми бачили слайди однакові, бо в Jill слайди рухаються, а в нас чомусь ні. Зараз почекайте хвильку.
Should I unshare and share again?
Yes, I think so. That would be better.
Okay, let's see here. No, I don't seem to have the unshare button or to turn off the...
Probably you'd like stop sharing and then...
yeah, I just can't find that window on my screen, which is also unusual.
Yeah, it is. It's probably on top there somewhere. I will just ask our operators at the same time if they have any ideas. Хлопці, чи є у вас якісь ідеї, бо Jill не може в себе знайти цю...
Are you seeing anything on the screen right now?
They're already for a while, just the same slide.
Okay.
The slightly brownish blocks.
Yeah.
Others are looking from their side if they can stop and then you restart. Хлопці, чи ви можете подивитися зі своєї сторони?
I'm just trying to see if it's on my other screen. I can't.
It's okay. With online, these things happen, but you know, there is.
Yeah.
So it's fine. We will fix it somehow. It's okay.
But that's very annoying.
It's less annoying than, for example, these drones or missiles. It's okay.
Oh, that's fair. That's
It's
fair.
okay.
Okay. Let me just see if it's.
Подивіться, будь ласка, на мій екран, бо на моєму екрані інша картина, бо, може, я щось не бачу. І зараз ми від учасників спитаємо, може, в учасників щось. Зараз ми спитаємо, що від...
Okay. So I've just shut down my presentation, but are you still seeing it?
On one of the screens, yes, but can you try to share it again? Because the operators are asking to share it again.
Yeah. Just need to.
Ми всім дякуємо, що ви терпляче чекаєте. Почекайте ще трошечки. Зараз спробуємо. Що, хлопці, ви бачите? Ага. I can see something is changing definitely on the screen. I can see now that it's the beginning of your presentation.
Okay.
But let me... Хлопці, можете подивитись на мій екран, чи так у вас теж зараз виглядає? Да, все так? Ага. It's okay now, so as soon as you find the necessary slide, you tell us, and we check if it is seen for the full screen, because now it's not a full screen.
Oh goodness. Okay, it is.
Now I can see the small slides, and the number of small slides and one big.
Oh.
Not to the full screen, but let's try to see. Okay, now I can see the slide. Very preterm infants are at high risk for DCD. Great.
Perfect. This is
Good.
where we should.
So if something goes wrong, I will stop you once again. I apologize in advance. Всім дуже дякуємо, що ви почекали, але наразі ми бачимо саме той слайд, який треба, то прошу Джиліан продовжувати.
Okay, thank you so much. I apologize for that. I'm not quite sure what happened there, but as I was saying, that children who are born very preterm are at much higher risk. And for every week prior to 39 weeks corresponds to a 19% increased risk for DCD. So this is a group of children that should be routinely screened for DCD because of this high risk. And I'll talk more about that in just a moment. Now I just changed slides. Is that, are you able to see additional risk factors?
Його відповісти треба. Yeah, I can see additional risk factors for DCD.
Okay, perfect. Great. So males are at much higher risk as well. And DCD often co-occurs with speech and language difficulties. So sometimes when children are very young and they have speech difficulties, that could also be a warning sign to monitor for DCD as well. Children with autism are highly likely to have DCD. Children with attention difficulties, and those that may have been exposed to alcohol or drugs in utero. So there are 4 diagnostic criteria for DCD, according to the Diagnostic and Statistical Manual. The first is that the motor skills are substantially below what you would expect for the child's age and their opportunity for learning. The second is that these motor skill deficits significantly and persistently interfere with daily life, that being self-care, school performance, leisure, or play. The onset of symptoms is in the early developmental period, and the motor deficits are not better explained by some other condition, such as an intellectual disability, visual impairment, or another neurological condition affecting movement. I'm going to talk about how to operationalize each of these diagnostic criteria in a moment, but what I want to focus now is on the onset of symptoms in the early developmental period. As I said at the beginning, DCD is not often identified until school age, and so we want to try and identify children sooner and intervene sooner. So in terms of early signs, early motor performance from as young as 4 months of age in preterm infants gives some risk factors for DCD. So I'll explain this more specifically in a moment with a study that we did here at BC Women's Hospital. The motor milestones may or may not be delayed. They may meet their milestones, but they have a history of difficulty learning motor skills. So being able to learn to swim or tie their shoes, use a spoon, for instance. They're less active in motor-based play, and they tend to avoid fine and gross motor play, even from a young age. The other thing we have determined is children who have early motor difficulties or early feeding difficulties, are at higher risk and have difficulties with their day-to-day activities. And as I said, language and communication delays are common and are social and emotional difficulties, usually secondary to the motor difficulties. So I'm going to talk about a few studies that we've done in a cohort of very preterm infants. And we looked specifically at feeding, as we know that sucking and swallowing is a sort of complex behavior that requires a lot of coordination. So this is the first sort of motor skill that an infant needs to learn. And we know that in preterm infants in particular, they may have difficulty with feeding. And we know from the literature that feeding difficulties can be predictive of a major neurological disorder, such as cerebral palsy or global developmental delay. But it was unknown if children with DCD actually have poor feeding difficulties. So we examined feeding behavior of infants born extremely preterm. In our NICU here, we followed children less than 29 weeks. And their first follow-up visit is at 4 months of age. So we looked at their feeding behavior at that time and motor outcomes at a future follow-up visit at age 4.5. I'll skip over some of this material to make up for some lost time, but basically we looked at all the children who were seen at follow-up up until 2013 and excluded those who didn't meet, who didn't have perinatal or follow-up data, and any children that had severe visual or hearing impairment. So this cohort included 412 children. The feeding behaviors at 4 months was just by parent report or clinical observation by the occupational therapist. And the motor developmental outcomes at 4.5 years were categorized as typical motor development, DCD, which we defined as less than the 16th percentile on the movement assessment battery for children. And then a major neurodevelopmental disorder, like I say, CP, global developmental delay, autism, or fetal alcohol spectrum disorder. So here is the breakdown of the cohort. So 47 of these children had feeding difficulties. And those that had feeding difficulties tended to be of lower birth weight, had lower 5-minute APGAR scores, required more ventilation and oxygen, and had lower motor scores at 4.5 years. But if we look at their outcomes based on feeding, the three main categories, the typical DCD and major neurological disorder, you can see here that 40% of the poor feeders had probable DCD at 4.5. And that's even higher than the major neurological conditions at 36%. So that it's more prevalent, but it's also very predictive. When we looked at sex, ventilation, APGAR, birth weight, and gestational age, feeding difficulties was the greatest predictor of DCD, almost 3 times more likely compared to those that were typically developing. So this tells us, although feeding might be the primary issue at that time, it is predictive of future outcomes, particularly DCD and other conditions. And so that's sort of the first indicator that follow-up might be required. We also wanted to know can DCD be predicted at discharge from neonatal intensive care? And so we did a retrospective chart review looking at 101 very preterm infants. We excluded those children with those major neurological conditions and looked at feeding and respiratory status at discharge, age-related data, sex, DCD diagnosis, and their performance on the movement assessment battery for children. Of these, 26 children were identified as having DCD, and 75 were non-DCD and didn't have any major neurological impairment. Now, none of the variables we put in our model were predictive, but there were some significant trends noted. And in particular, children with DCD were more likely to require respiratory support, less likely to be breastfeeding, and were significantly older at discharge compared to the typically developing group or non-DCD group. I mentioned earlier that early motor performance can also be predictive. And here we looked at motor performance at 4.5 again, but all of the follow-up points that we saw the children from 4 months, 8 months, 18 months, and 36 months, we looked at the trajectory over time. Overall, we had 88 children with DCD in this cohort compared to 241 without DCD. And here, this is just describing the participants. Children with DCD were more likely to be male, of lower gestational age and lower birth weight compared to the non-DCD group. But what's interesting is their performance on different motor tests. So I know there's a lot of information here, but I wanted to put it on one slide so you can see the patterns. So, so here we have the DCD group and their scores, and then the non-DCD group and their scores. This is the movement assessment of infants that's conducted at 4 months and 8 months. And higher scores indicate poor motor performance. Here's the Bailey 3 is what we were using at the time. That was conducted at 4, 8, and 18 months and 36 months. And then the Peabody Developmental Motor Scales were also administered at 18 and 36 months. And what you can see here is that for every motor test, children with DCD scored lower than the non-DCD group. The other important thing to notice is that these scores are very close to the one standard deviation. So may be, considered, strictly speaking, in the average range, but these children were the ones that went on to develop DCD. So it's those kids in that borderline range that we need to also pay attention to from these motor tests. So on every single test at every time point, they scored more significantly poorer. And we know that the Bailey 3 tends to under-identify motor impairments. It'll be interesting to see now with the Bailey 4 what happens with that information. We also wanted to look at the movement assessment battery for children. If we assess the children at 3 years, was this predictive of DCD at 4.5? And again, to try and find this sweet spot for early identification. So in this case, we excluded children with those other major neurological conditions, had to exclude those who didn't have a movement assessment battery for children. And then some children were untestable, either because of immature or significant delayed motor skills, poor attention or focus, not able to undergo a standardized test, or had some behavioral concerns that weren't able to follow the instructions. So we ended up with 165 children. And of these, so the children that scored less than the 5th percentile, this is the criteria for young ages, which I'll talk about in a moment. The sensitivity to pick up those children with DCD is very high at 90%, but it's not very specific. And there were also a lot of false positives at this age. So it was very good at identifying, it picked up the children who had DCD, but also flagged some other children that may not have developed DCD. And in that cohort, we found that 1 in 5 very preterm children weren't able to complete the movement ABC. Okay. What I'd like to do now, that's a lot of background information. What I'd like to do now is describe how to assess for DCD. And this is usually a team approach. So for the first criterion, which was the motor skills are substantially below what you would expect, this is typically assessed with a standardized motor assessment. The gold standard is the movement assessment battery for children, but you could use other motor assessments such as the Brunick-Sozaretsky or Peabody developmental motor scales, just some standardized motor assessment. It's usually conducted by an occupational therapist or a physical therapist. And the cutoff score is usually the less than or equal to the 16th percentile. But for very young children, the criteria is more stringent to use less than or equal to the 5th percentile. And this is over 2 assessments conducted at least 3 months apart. Just to monitor that it's not just a blip in their development, but is this something that is persisting and perhaps even getting the gap widening between where they should be with their motor skills. The second criterion is the impact on daily life. And there are a number of tools or activities. Again, in our center, it's the occupational therapist that, and sometimes the physical therapist that would provide a questionnaire to the parent to complete. And I'll talk about each of these. There's the Developmental Coordination Disorder Questionnaire, or DCDQ, for children from age 5. But there's also now a little DCDQ for 3 and 4-year-old children. And there's also an interview guide to listen for DCD. So the DCDQ is just a brief questionnaire with 15 questions, and parents are asked to rate their child's ability to do various motor tasks. And it's very quick to score, and you end up with an interpretation of either indicative or suspect DCD, or probably not DCD, to give an indication of how the motor difficulties interfere with function. Similarly, the little DCDQ asks parents to rate their child's performance. And in this case, because diagnosis was not recommended at a young age, you get either suspect or probably not DCD cutoff scores. There is for the Canadian version, the Canadian version of the little DCDQ, there is a one-time $50 charge, but for the DCDQ, it's freely available online. And it has been culturally adapted and translated into many languages, but I could not see a Ukrainian version as of yet. So if you have a student that might be interested in that, we can certainly collaborate in that regard. And then the other tool is a Listening for DCD interview guide. This is also freely available on the CanChild website. And this gives you questions to ask parents and then what you're listening for. So those, early motor difficulties, taking longer to learn motor skills, how they're performing at school and at home, and so on. The third criteria is that the onset of symptoms is in that early developmental period. And so this would be your usual developmental history and developmental screening. But you also want to listen for those early warning signs that we discussed. So any history of feeding difficulties, avoidance of fine or gross motor play, any speech concerns or concerns with attention, for example. And the final criteria is that the motor skill deficits are not better explained by moderate to severe intellectual disability, a significant visual impairment, or other condition. In previous guidelines, it was recommended that cognitive function be assessed routinely, but now the current guidelines suggest that if the child is performing, in a regular classroom and a normal history of school achievements, albeit they might have some learning difficulties, but not to the point of having an intellectual disability. There's no need to do standardized IQ testing, but in some cases that's still helpful because of the co-occurring learning difficulties. And then you want to rule out any other possible medical or neurological condition. And to help with this, we published in the Canadian Pediatric Society a practice point to look at various conditions that would be a differential diagnosis for DCD. So these could be musculoskeletal conditions, genetic, neurological, and so on. So this practice point highlights some of those, but we also have information in toolkits that we developed. The advocacy toolkit is for physical and occupational therapists. And then we have a toolkit for pediatricians, which has basically taken the international clinical guidelines and put them into 3 or 4 pages of the most pertinent information. And this is one example of an algorithm for the diagnostic criteria, for instance, and how you measure each one. So the other aspect that I'll just touch on is about treatment for DCD. And Physical and occupational therapy are important to help the child learn motor skills, but the type of therapy does matter. There's lots of systematic reviews that have been conducted, and the common feature is that task-specific approaches are the most effective. So actually working on the motor skills that the child needs to learn, not the component skills such as, balance or fine motor skills by themselves. And the most researched and the best evidence that we have is for an approach called co-op, or cognitive orientation to occupational performance. I didn't prepare any further description of this, but I'm happy to discuss this in the question period. The other piece of treatment would be resources for families. And in particular, there's an online workshop for parents on the Can Child website. It is only available in English and I think in French, so I apologize it's not available in Ukrainian, but there may be an opportunity for some translation or some information from this workshop. And there's also a host of resources, in particular for school teachers on how to modify tasks or having an understanding of DCD and the impact that it has on the child. The children are often described as lazy or unmotivated because the teachers see a very capable, bright student, but their written output is not, they're underperforming in that area. And so the first sort of instinct is to say, well, if they just tried harder or if they were a little bit more motivated or apply themselves, things would be better. And in actual fact, we know from our brain imaging studies that children with DCD are actually working twice as hard, recruiting twice the number of brain regions than children without DCD to perform fine motor tasks, for instance. So just to summarize and to leave some time for questions. So the key messages are that preterm infants are at very high risk. Feeding difficulties in the NICU and in early infancy might be a warning sign for DCD. Early motor assessments may be indicative for DCD, but it's those children who are scoring just within the average range or slightly below. So around that 85th score on a scale of 100, or where 100 is the mean, pardon me. And that what we're advocating for is preterm infants to be routinely screened and followed before school entry so that the family and the child can begin the school year with some understanding from the teacher of the difficulties this child may have in the classroom and ways to support the child. And I'll just finish just by acknowledging the children and families who have participated in our research studies, my research team, my trainees, and my past and current sources of funding that allow me to do this work. And I'll now take time for questions. I apologize, I went quite quickly there just to make up some lost time.
Чи мене чутно, чи ні?
I can hear you now, yes?
Окей. Я бачу, що учасники просять презентацію. Так, ми цю презентацію віддали в переклад і можемо з дозволу пані Zwicker її використовувати для вас. Я так розумію, що дозвіл такий є, вірно?
Yes, That's correct.
Тоді, поки ви думаєте над своїми запитаннями, я задам, мабуть, свої. Якщо так взяти з всього того, чим ви займаєтесь, якого наступного якісного стрибка ви очікуєте від системи охорони здоров'я? Саме в тому, в чому займаєтесь ви. Що повинно відбутись наступне таке, що буде давати якусь різницю, що буде щось по-іншому?
Yes, that's a great question. So what we're doing now, at least here in Canada, and I know in many places around the world, screening, assessing, and treating children with DCD is not standard of care. So our first line of attack was to increase awareness of the condition, and also to build capacity of therapists and pediatricians to be able to diagnose the disorder. We are now making toolkits for primary care providers, so family physicians, nurse practitioners, and a toolkit for families to identify early motor concerns that they can take to their primary care provider, hopefully for earlier identification. And we are advocating with our government to have this as standard of care, which means it would be covered by our universal healthcare system. At this point in time, though, families would need to pay out of pocket for the therapy evaluation.
Ви сказали, що ви розробляєте такий тулкіт для сімей. А де ця грань? Де це лікарська справа або медичного працівника, а де це справа сім'ї?
I'm not sure I understand the question.
Let me then ask it in English, probably. You said that you are developing the toolkit for families.
Yes.
So where is the borderline? Where is it a medical issue of the doctors and nurses, and where is this the family issue to identify the problem with the toolkits?
Okay, so for the families, many parents, we've interviewed parents, and we've also done surveys of parents who either would recognize that their child's having difficulty or would appear different on the playground compared to other children and, climbing the equipment or, how they play with other children. But they would take their concerns to their primary care provider and either be dismissed that it's no big deal, it's nothing to worry about, or they'll outgrow it. And so they often have to go, several times to see a medical practitioner to then ultimately be assessed. So it's parents or teachers may be the first to identify concerns. But ideally what we want is for the primary care provider, as part of their routine well baby or well child visit, to screen for DCD like they would screen for autism or cerebral palsy, for example. That's the long-term hope, is that we'd be able to screen children routinely, and then also for the children to receive the therapy that they need as standard of care.
Ще таке питання. Ви сказали, що наразі батьки самі сплачують таку оцінку. Скільки це коштує наразі для батьків?
Usually, well, depending on which professionals they see, if they see an occupational therapist, that could be upwards of $500, say, for an assessment and report but sometimes they might see a psychologist for thorough screening of other difficulties, and that can be upward to about $3,000. Currently, the medical appointments are covered with our universal health care. And for the preterm infants that are being followed, that's also covered. So the preterm infants would have an advantage here, but not other children who are not being monitored or aware that they might have motor difficulties.
І питання від наших глядачів. Перше питання від пані Тетяни Голосової. Таким дітям, якщо це не ДЦП, ставлять діагноз мінімальна мозкова дисфункція, чи це просто диспраксія?
So the dated terminology would be dyspraxia. It's not mild cerebral palsy. Some people think that's a continuum, but their presentation is very different. So it would be more like dyspraxia. So some people still use that term, but the international guidelines recommend using developmental coordination disorder as the preferred term to help build the evidence base and have consistency amongst understanding the condition.
Пані Олена Безпалько питає, як інтервенції на етапі інтенсивної терапії новонародженого можуть впливати на довгостроковий розвиток моторики?
Good question. So what we know is there are some predictors. So for example, children who have been exposed to morphine show poor cerebellar development that impacts motor skills. And how sick the baby is in the first 24 hours of life, so this would be a SNAP score, was associated with the development of the corticospinal tract, so the main voluntary motor pathway. We also know that the number of painful procedures, so even skin pricks for blood tests, and so on, the higher those painful procedures also affects brain development. And so there's several things that are happening in the NICU that are, necessary for, life-saving care, but also has implications for long-term development. And so that would include, judicious use of morphine, maybe trying to minimize the number of blood tests that are necessary, and so on.
Пані Ірина Хмілєвська питає, тобто в терапії ми прагнемо до формування навички в цілому, а не окремих компонентів навички?
Correct. Yes.
Пані Ірина Хмелєвська питає, які клінічні ознаки DCD ви можете назвати для прикладу, якщо не використовувати названі шкали?
I'm not sure I understand that question either. Sorry.
I will try to translate in my own way. Which clinical signs of DCD you can name, for an example, if you do not use the scales you mentioned, the evaluation instruments you mentioned?
Gotcha. Okay. So some of the questions that you can ask the parent is, say about learning to ride a bicycle, for instance. These children have tremendous difficulty with that, and also may be much later to ride a bicycle. They may also have difficulty with swimming lessons. That's a common activity here for children to do. And so they would struggle with swimming lessons, not being able to tie their shoes or use a knife and fork, for example. So some typical childhood activities that you could ask about and how they're performing compared to their peers. Or if they, shied away from the playground, didn't want to climb on the equipment, do they withdraw from physical activity? They don't want to participate in sports, for example, those types of things. That listening for DCD checklist that I mentioned, that's free, also provides some other guiding questions and what you can listen for.
Пані Тетяна Боряк питає, як у дітей шкільного віку проявляються симптоми РРК?
Okay, so at school age, probably the most apparent would be printing skills or their writing skills. They have difficulty with letter formation, alignment of words on the line. They would have difficulty using scissors. They may have difficulty, young children, when they transition to go outside for recess, might have difficulty with zipping up their jacket or changing or tying their shoes for PE class, for instance. They might have difficulty with other fine motor tasks, such as playing with blocks or beading or artwork. So anything that involves fine motor skill in the classroom, and then it could also appear on the playground at recess.
Пані Олександра Паночовна питає, чи бачите ви потенціал у використанні віртуальної реальності або інших технологій для діагностики та лікування DCD? Можливо, є якісь дослідження?
There are some studies looking at virtual reality. So I haven't looked at them recently, but children with DCD also have trouble generalizing from one task to another. So if they learn it in virtual reality, it's difficult for them to translate that into real life. But I think it does have potential. And I know that there are some researchers looking at apps to help with diagnosis, whether that's looking at a child's gait, for instance, or how they perform motor tasks. So there's definitely some technology things that work for both assessment and intervention.
Пані Олена Безпалько питає, яка роль батьків у підтримці розвитку координації рухів у передчасно народжених дітей? Чи є конкретні рекомендації щодо домашніх вправ чи активностей?
Great question. So I think the first thing I would say is that parents have told us that having a diagnosis helps them parent their child differently. So for example, the parent themselves might experience frustration when the child's not able to learn or do things, or that they're making a mess at the table or spilling. If the parent realizes it's because of this neurodevelopmental condition, they're a lot more understanding and patient. The other piece is that children with DCD tend to do better with cognitive-based approaches. So it's like their body doesn't know, it doesn't get the feedback that it needs to learn implicitly. And so they do better with more explicit instruction. And that's the basis for the co-op approach. It's a problem-solving approach. So it's more about teaching the child differently, using more verbal skills. And then, of course, providing opportunities for the child to engage in physical activity. And children with DCD tend to do better with more individual-based sports or activities, such as Taekwondo, for example, versus team sports like soccer or basketball.
Зараз нас все ще, до речі, 205 людей в Zoom і 8 в YouTube. Всім дуже дякуємо, що лишаєтесь з нами. В нас ще є буквально декілька хвилин. Так, пані Лілія Бессонова питає, оцінку можуть проводити як лікарі, так і медичні сестри? І чи приймають медичні сестри самостійні рішення?
Yes, of course. So in our healthcare system, so the nurses, for instance, in the NICU period would certainly observe feeding difficulties and could flag children who may be at risk. And nurses also play a role in well baby visits. So they would be critical for those, the screening process that we're hoping to institute. And nurse practitioners can act as primary care providers instead of a family physician. And so they would have a critical role to help evaluate or refer on to a pediatrician, for example. I would say other than those sort of community-based settings, nurses aren't really that involved in other areas. Like the children wouldn't be seen in other medical reasons unless they have a lot of falls, perhaps. So they might be seen in emergency for, you know, falling off the monkey bars or so on. So if the child has a history of falling, that could also indicate DCD. So nurses in ER might have a role there too.
І останнє питання. Так, в нас таке. Від пані Юлії Мадяр. Чи потребують такі діти особливої уваги у навчальних закладах?
Yes. So again, this isn't necessarily standard of care, but the children should have accommodations. For example, less demand of written output. So instead of doing 20 spelling words, can they do 10 to demonstrate their knowledge? Or can they use a computer for written output in higher grades? They might need more time for examinations or tests, and other accommodations so that they can meet their potential. So children with DCD tend to be of average to high IQ. And there's a saying that they're bright, but they can't write. And so teachers, if there's alternative ways, if they can, present orally instead of writing to demonstrate their knowledge. So being more creative in how we evaluate them and provide different opportunities for learning and sharing their knowledge.
Дякую дуже, Джил Зwicker, за цей вебінар. Всім дякуємо, хто був з нами. Вас було багато, 205, навіть іноді більше людей, і ще люди на YouTube. І ми всім дуже дякуємо і нагадуємо, що цю серію вебінарів ми організовуємо разом з Національною службою здоров'я України, Міністерством охорони здоров'я України, ЮНІСЕФ в партнерстві з Асоціацією батьків передчасно народжених дітей «Ранні пташки» за підтримки Уповноваженої Президента України з прав дітей та дитячої реабілітації і з Асоціацією сімейних медичних сестер. Весь цей проєкт підтримує уряд Німеччини через банк розвитку KfW. Всім дуже дякуємо, що нас дивились, і дуже дякуємо Джил Zwicker за час, який нам всім вона сьогодні приділила.